Good evening, and welcome to another episode of Couch Caucus. I'm Bree, and Amanda's joining me from her couch at her house. And tonight we are going to talk about the governor's state budget address and a little bit of what the counter positions were from the Democratic representatives from the legislature and from the Democratic Party. But we're also just going to kind of talk about it in terms of like our understanding of some of the issues that weren't even addressed in that counter in their counter presentation. But we're going to start with one of the things that is, it's kind of this like it's like a con move, right? So the governor said that all state employees and teachers and other people in this list of people would be getting a 2.4, was it 2.4 or 2.5?
2.5.
2.5% increase, which, is still like state employees have not received a cost of living allowance increase or any kind of increase in salary for over 3 years, right?
We did have a raise, I want to say this past year, but we did have a period in that end of Dugard administration transitioned into Nome where state employee salaries were frozen.
Okay. So basically there's not been this, there hasn't been a kind of a practice of raising wages to keep up with inflation, cost of living, and all of those things. And so on paper, it sounds, and then, on camera, when she's presenting, it sounds great. You're going to get this 2.5% increase. The Democrats are saying it should be more like 3%. But what the public doesn't know is that the state is also now completely overhauling their health insurance plans. And it's just kind of, so first of all, this is why health insurance should never be tied to employment in the first place. And we're going to get into some health stuff later based on, things that should have been used with this money that weren't. But, okay. So Amanda, so now, as of today, as a state employee, do you pay a premium? Is that like a benefit you get that you do not pay a premium?
Correct. So one of the sort of perks of working for the state is that the employee, your health insurance premium is covered as part of your sort of compensation benefits, whatever. And that was always sort of one of the big draws of working for the state is that, you didn't have to pay your health insurance premium. You did if you had a spouse or kids that you wanted on that insurance, you had to pay a premium for them. But the employees, we had our premiums covered.
And then what is your deductible now?
I want to say I'm on the high deductible plan, which is, I think, the $5,000. That's the other thing is also when I started 7 years ago, the deductibles for our plans were also much lower. It used to be that our high deductible plan was like a $2,500 deductible, and it's kind of crept up over the years. So there's definitely been an eroding of the health insurance benefit, that state employees have, that we were getting. So that's been, retirement's been doing great though, but the health insurance plans, there've been some issues.
So, and I suppose, it's like I've done this juggle before. It's like you weigh like, okay, my general health risk, the odds of me needing treatment, family members, all those things in terms of, is it worth paying for this benefit plan? So now, because that deductible is really high. But if you're a healthy person, you kind of hedge your bets like, well, hopefully I won't need, I won't ever have like this massive bill where I have to come up with that much money all at once, right? Because it's like just general over time, it's like a certain amount with each of those appointments. So in the last couple of weeks, this new health plan is rolled out for state employees. And not only does it end up like really kind of dinging state employees in their pocketbook, but it also has the cheesiest name associated with it.
Yeah, it's and so when you're trying to keep track of like, okay, like which plan is which, the names obviously don't relate at all to the benefits that are being, bestowed upon you. The plans are named after the faces on Mount Rushmore because apparently we can't not ever honor the old dead white guys that we carved into native lands. Good job, us. So we've got Washington, Lincoln, Jefferson, and Roosevelt. And, it's up to you to guess, like, which way do you start for, high deductible or low deductible. But yeah, the Washington plan is first on the website, and that one is the only plan that is no zero premium for the employee. So that's the plan to keep if you would like to continue having the state pay your premium per se. It also has a very high deductible, though. That deductible is the $5,500, and the high deductible plans for the state have had the health savings accounts for the past however many years. So for, folks that have been, taking the money tax-free out of their paychecks to, throw into the HSAs, we do have that benefit, which is a nice way to save for that $5,500 deductible.
Yeah, except for, so let's talk about this pay raise. So sorry, I've got children yelling in the background. Yeah. All right. So you get this 2.5% raise, which we figured out if you make $40,000 a year, because, state employees aren't like rolling in the big bucks. That's like $1,000 a year pay increase, which, on paper, again, it's like, it's better than a kick in the pants. But at the same time, you're now basically losing this great benefit you had. So if you figure out like what the premium was that you weren't paying for that benefit and multiply that by 12, right? You're looking at, so I'm guessing the premiums probably are about 200 something a person that the state was paying for you. And so even if it was just 200 a month multiplied by 12, that's like, so basically you're getting you were getting a $2,400 benefit at least, right? As an individual with the health plan, or maybe that was with the family rate. But now it's like, you're not getting the same benefit that you had in terms of the overall, like, money out of your pocket, right? If you think about what families are now going to have, a family in particular is going to have to spend for their premiums to cover their family. It's going to be about 200. What was it again? What did you say? It was like 200 and I'm trying to remember. It was 200
for the
I did the math and it figured out to $185.58 a month for the Lincoln plan for a family.
Okay. Yep. The Lincoln plan. So the Lincoln plan, that's the one, if you're the employee, you're paying about $25 of that is your premium. And for a family, spouse and kids, it's $185.66 a month for a plan that has a $3,000 deductible.
Yeah, I can speak from experience that, especially as a teacher, which, basically, like in South Dakota, I got lucky. I worked in a district that paid fairly well, but I was probably like bottom end of the state worker pay scale. And I have a child with major medical stuff. There is no way that, if I got slapped with a like $6,000, $4,000 deductible for healthcare, like I don't know where that money would come from. I really don't. It's really kind of to me, it feels like a big FU to your employees to kind of pull something like this, especially when the state was sitting on $19.1 million in surplus as of June, and now wants to do this like kind of money laundering thing where she wants to take $50 million out of the COVID CARES money and put it into a trust fund for who knows what. She wants to raise the reserve cap it now sits at 10%. Like we have a law that says we have to have 10% of our expenditures or budget has to be set aside for rainy day fund, which is great, but she wants to raise it to 12%. All of these pieces where it's just kind of like you said, it's like a dragon sitting. I'm thinking about Smaug sitting on that pile of gold, and and Lord of the Rings or in the Hobbit, and it's just like to whose benefit, right? Like nobody is going to benefit from this if you just constantly. And it just seems outrageous to take this money from that isn't intended to be used that way. That COVID care money is for like emergency needs right now, or even just that surplus. like how much would it really cost the state to continue to offer the benefits that are provided? I mean, I just don't, it's just amazing to me that that's kind of, and then to just say, we're going to give you a raise. Oh, and by the way, like that was totally like undercover, right? It wasn't.
Well, and so here's the thing too, is like, she said 2.5% raise in her budget address, but that doesn't mean that it's going to make it through appropriations and pass on the legislative floor. Like, she can say that, and so really, that's the place that's going to be started. That's the starting point for the bargaining, is that 2.5%. So, I agree with, Senator Nesbitt and the Democrats that should have started higher, because we all know it's not going to end up being that maximum. Maybe we'll be lucky to get out with a, 1.5% raise if we get anything. But yeah, South Dakota has the rainy day funds, and we apparently are never going to experience a day rainy enough to use any of that money. And what the study just was published this week talking about trickle down economics, and that even, we finally determined that it does not work. But in South Dakota, the state government is the 1% that's hoarding the wealth of the state and not even, dispersing it to the citizens that it's, collected that money from. So, there really should be a lot more outrage about the massive surpluses that the state is, constantly sitting on. And, we always have the conversation every year that, people are talking about, sales tax revenues and, all that stuff, because our income as a state generally depends on people spending money here, because we tax food, which is one of the most regressive ways that you can, generate income for a state. And because, the words income tax in South Dakota are like this super awful, scary, dirty word. And if you say that, you're never going to get elected, because nobody here wants to pay income tax. Whereas that would be a much more stable way to generate revenue for South Dakota, and also would not put an unfair tax burden on, our, poverty line and below South Dakotans. So, yeah.
Well, yeah. And then think about, so it occurred to me tonight when I was doing a little bit of digging into the numbers, that if, think about projected revenue from the legalization of pot in South Dakota. And that isn't even factored into all of this in terms of thinking about, well, we got to be careful about money we spend. And meanwhile, she's like fighting that tooth and nail as well, spending state taxpayer dollars, by the way, on a lawsuit that's brought by government employees against the initiative that the citizens of South Dakota voted to put into law. So this is, and then meanwhile today, like I noticed that 3 men were arrested in Pierre for possession of pot. I'm just like, okay, really, like, and all the charges they were charged with. So that's like another story for another day. But I just think about like the cost to, okay, first of all, it is related. Cost to society of like incarceration and all those things. Although in some communities like our county, we count that as a revenue source. Our county looks at our jail as a source of money, which is like really, really horrible financial plan for anybody to be thinking that way in terms of we're going to be making money off of people's misery. So anyway, so let's get back to this whole thing about the state budget and health benefits and some other things related to this. So, you just made the comment like, apparently there will not be a day that's rainy employment. And I'm thinking, how many months are we into this pandemic? And thinking about like the current unemployment rate, I think not the rate, the unemployment rate in our state is pretty low right now. And they like to tout that, but the current amount of people who are unemployed is 16.9% for October. I went and looked, and I was like, well, that's a lot of people. And then I think about, or even if you're underemployed, like how many people are making minimum wage or are in a service industry where they're expected to make up those wages in tips, and they're not getting benefits. So they're not getting health insurance benefits or those things. I'm thinking about all those costs. So what I got thinking about too is like, if you get sick with COVID and your medical expenses, if you're underinsured or uninsured, and I looked it up and it's like $50,000 for an uninsured individual for just like the initial inpatient care. But if you end up being in the hospital for 6 to 10 days, it's like $150,000 to $200,000 that you're going to be, you're going to end up with this bill. And so certainly there's people all over our state who are facing this medical debt right now because of this situation. And I think it's like 4% of our population has medical debt currently, and on the verge of going to collection. And there was actually an article talking about how, there's concern that that's going to go up a lot because people are going to have these huge bills. I mean, even just a COVID test, like if you go to the clinic to do it and you don't have insurance, you're billed $200 for a test. Granted, now the state's offering this free test, but you have to be able to get it. You got to mail it. You got to, all those things. So that I started thinking about that with the medical costs, and then that got me thinking about Medicaid expansion. Yeah. And of course, that is something that that's obviously a very timely issue too. So what's going on with Medicaid expansion?
So right now, there are petitions that are out and being circulated by the group Dakotans for Health. And so they've got both a petition to put it in the Constitution to expand Medicaid, and then also an initiated measure. So kind of doing the same strategy as marijuana did, having both constitutional amendment and initiated measure. And unfortunately, I did not catch their latest webinar tonight, but there is another group of different people in South Dakota that have submitted essentially the same ballot language to the Secretary of State to expand Medicaid. And so the second group that has submitted that information, or has submitted that, is, I think it's like a group of it's much more of I would kind of want to say the medical establishment. And so it's very confusing. I don't understand why the second group is essentially proposing the same language. And I guess we're going to have two petitions out there, four petitions out there that are essentially all doing the same thing. So I'm definitely curious to catch up on sort of what I missed from the Dakotans for Health presentation and just see what the hell is going on with that. And that whole thing kind of speaks to this issue in South Dakota that's becoming sort of more and more apparent after the 2020 election, is that there's a lot of people that do want to do really good things, but there are a lot of people that they feel like they have to be the leaders when they're doing those good things. And so we end up with a whole bunch of people reinventing a whole bunch of wheels when we've got groups that are out there on the ground doing the work, and those groups need people to, hop on their webinars, take their trainings, show up for their events, and as it's not meant to sound bad, but those groups need followers. And, I know in our nation of rugged individuals, nobody wants to be a follower. Everyone gets told they need to be a leader, but we need people to kind of start to coalesce and work together on this stuff, because we definitely don't have enough Democrats in South Dakota to be running 5 petition drives on the same issue. So I'm definitely going to be curious to see what the hell happens with this Medicaid expansion, because it's an idea that is that's time is past due in South Dakota. I have no doubt that it will be on the 2022 ballot, but I want to have the best version on the ballot, and hopefully something that, whoever our governor is at that time just, doesn't try to sue the state for.
Yeah. I mean, that's kind of concerning, because then it ends up kind of diluting the effort in terms of, thinking about the number of signatures you need on a petition. And there's going to be a lot of confusion because people are going to think they've already signed it. But, yeah. and just, I'm kind of curious too, as to how much, what exactly is different about the two petitions, and why would another group start something else unless, there's just some political machination happening behind the scenes that we don't know about in terms of who initiated Dakotans for Health versus this other group. So yeah, I'm kind of curious about that too. I didn't get to do that webinar tonight either. But what occurred to me is I was thinking about $50 million in COVID care money going into a fund. It's I think that's how much extra. I mean, it's not even that much. I'm trying to remember how much more it would cost the state to expand Medicaid. Mm-hmm. And do you remember how much it was per year?
I don't. But it's one of those things that, we totally have the money sitting around somewhere that we could have done it.
And even, and that's the thing too. It's like, I remember finding the number somewhere at some point. I know like under Dugard, they said it would cost the state about $57 million if they were going to do expansion by 2021.
Mm-hmm.
And I think our cost share last year was like 27 million, maybe. So, you're looking at another $30 million, which if she was just going to put $50 million of this COVID care money, I mean, at least I would have like floated for this next year. And, if you legalize pot, you're going to get all this money you could pay for health benefits for people. She went upstairs. She went upstairs.
Nina?
Yeah, Lena went upstairs. All right. So then the other thing that I was looking into with this is that, I started thinking about that, the amount that was actually in the COVID care relief money. And it's like, it was $150 to $200 million is what the state received. And just thinking about how that money is being used. Yeah.
Penny.
I don't know. You're going to have to ask Dad about that.
Penny.
I don't know where it is.
Penny, they
Can you go ask your daddy? Yeah, go ask Dad. He'll grab it for you.
Penny.
I know. Go ask your dad.
Mom. Penny.
Okay, so I started thinking about that in terms of like even just the PPP support that went out to businesses and everything else, and how like all of a sudden this last minute now they're like changing the requirements for people to apply, so more people are eligible to apply. But it also sounds like they're way behind in actually processing applications. And so anyway, I've been thinking about that, and if that like kind of like if the sun sets on that and December 31st, not to mention the fact that like those notifications that just went out about all of these, there were these rules that shifted about insurance.
Mom.
What?
Kitty.
Yeah, that's a kitty.
Yeah.
These rules that changed about like insurance and, all related to COVID, right? So we think about like, and I was looking into like the whole paid leave thing for COVID and how like in April, if you had a family, like a child who couldn't go to daycare because the daycare closed, like you could be eligible for family leave basically. Mm-hmm. But if you work for a company that's 50 people or less, then they're exempt. So you can't get paid leave if you have to stay home because your kid's on quarantine or because the daycare closed or the school closed. And then if you are sick or caring for somebody sick, you can get like 2/3 of your wages. But I don't know if that's also sunsetting December 31st. So there were all these things put into place, these kind of like safety measures. Mm-hmm. It would have been nice for her to say, okay, like to acknowledge, like even her refusing the unemployment benefits, right? The additional unemployment money for people. Mm-hmm. Because I'm thinking about like how many people are housing insecure right now. I mean, we already had an issue with affordable housing in South Dakota, and affordable housing, health insurance, all those pieces, living wage. And then now you're faced with 2 weeks of no paycheck for 2 weeks because you're home with your kid. Mm-hmm. And how many people are losing their job because they keep missing work because they are home with their kid. Yeah.
And it's just, well, and even for like state employees, some of the health insurance, like coverage of like the COVID tests and some of that stuff, that goes away on December 31st as well. So it's like, if you get COVID in 2021, like, I'm crossing my fingers that maybe the Biden administration, does something, but I feel like we've got this like donut hole in, from January 1st through inauguration where who knows what the hell is going to happen. And thinking back to, Noam saying no to the extra, federal unemployment dollars, that was she did it because it looks good to not have to take that money from the feds or whatever. But really, that money given to people who are qualifying for unemployment benefits, that's money that gets put back into the South Dakota economy. That's money that pays rent. That's money that pays for groceries at our local grocery stores, which we're charging 6% sales tax on food. She turned down federal dollars that would have helped to, stimulate local South Dakota economies. And conservative Twitter loves her for it. So yeah. Oh, I see Twilight Sparkle has joined us.
Future elected official right here,
Yeah,
leader.
exactly.
Yeah. So yeah, I mean, so that's what I started thinking about, like, obviously like things like expanding broadband access across the state is definitely like a high priority. And I'm really glad that she addressed that because, it's like, I think it's like 60% of rural families don't have access to good broadband or Wi-Fi. And, and I think it's like 65% of people on reservations. And so just in terms of in terms of like the amount of people who don't have access to internet, and then you think about the number of families that are having to do remote learning for school, and then even just like being able to, access resources to look for a job, all of those things. It's just that I was really happy about that. Also but I started thinking about like this, it's kind of those emergency needs again, in terms of, how many people are going to be, right now, obviously the CDC is saying you can't evict people, but it's probably happening. But what I was actually thinking about is, what about money that goes into like, repairing homes, rental, I think about even here in Pierre, which is the state capital, there's a whole section of town where there's these houses that are just, that they're rental houses. They're totally run down. How many people need just weatherization help with their homes so that they're not going to help cut down their utility costs in the winter, and or even just utility assistance. So all those little things, like putting some money into those programs where, right now you can't get utility assistance unless you meet a certain poverty level guideline. But I'm guessing with all of the unpaid leave and all of these other things that happen to people, there's a large section of the population that needs that help, who wouldn't normally need the help, but they need it now. And so it would have been nice to say, yeah, and we're going to set aside this much money for these emergency needs because people's basic needs need to be met, and it's winter. Yeah. And because we have the money now to do that, to support people, thinking about like, wouldn't it have been great if she said every South Dakotan's going to get, a little bit of money, kind of like how the federal government did that in April and is probably going to do it again, so that we could turn around and go spend it at businesses, local businesses. And yeah, so that's the part too that just kind of threw me, in terms of just nothing. It didn't seem like she had anything that really was specific to the crisis that we're in right now, and the actual impact on people across the state.
Because in South Dakota, we're not in a crisis because of COVID. We never shut down. We did everything, we stayed open, yay, freedom. Like, we're doing fantastic. So why on earth would she acknowledge that during her budget address? Like her acknowledging any of those things would mean that she's admitting that COVID was actually happening. Which, funny side note, there's a Twitter account that keeps track of Parler. And, Noam did post a picture of herself wearing a mask today in, I believe it was some sort of health facility where people were getting vaccines. And the people on Parler lost their goddamn minds because Kristi Noem had a mask on her face. And they were like, why are you covering up God's work? It was really quite stunning. I highly recommend checking it out.
Yeah, I saw that picture. I actually wonder if she was at a vaccine facility where it's like a research facility, or if it was a clinic, because it was clear it was somewhere where absolutely she didn't have a choice to opt out on that one.
Yeah.
And so some of the other things in her state budget address were, she wants to put $5 million towards the state's private plane budget. And there's a whole lot of questions behind that. Like, first of all, does the fleet need updating in that way? I'm still not sure, like, obviously, like, it's great if our Department of Natural Resources, and especially on the law enforcement side, has planes where they can quickly get to a site where there's been some illegal dumping happening, or, there's poaching going on or whatever, and you can quickly get there because we're so geographically isolated in the state. Fire spotting, like, I totally, like, yes, there's some things where it's like, it makes sense to have some planes, but even fire spotting is like, well, couldn't you also have drones that are operated? We've got, like, in the Black Hills, there's still lookouts where people are posted, and then, other kinds of technology you could be using. So, the big question is, does she really just want a new fancy plane for her to be able to fly around the country to do the things that she does instead of actually governing the state of South Dakota? And she wants to do it on taxpayer dollar. I mean, I'd like to assume that most of her gallivanting right now is paid out of her war chest, of her fundraising money, like less COVID, more hunting t-shirts kind of deal. But we don't know for sure. They're not being she ran on this whole transparency campaign, but she's like the least transparent person I've ever seen in office. She's got highway patrolmen as her security detail, and they won't disclose how many and how much money and who's paying for that. All of these things that it just kind of, when she says, well, we need new planes, it's like, do we though?
Yeah.
And for what purpose?
Yeah. And it's just like, the optics of, of getting a new private jet just really, really don't mesh with the current reality for, so many South Dakotans. So that's, we'll see if that line item makes it through appropriation.
Yeah. I mean, it's like the whole, like, Marie Antoinette, let them eat cake. I just picture glamour shots from the White House for a Christmas party and all of these things, sitting in a Learjet with some, millionaire, all these things. It's like, okay, there's a massive food line right now in Sioux Falls, people in their cars lining up to get food. And there have
been the massive food lines everywhere that those programs are happening. Sioux Falls, Huron, Pierre, Rapid City, across the state. And much like you said with, the utility assistance and stuff, like, there are definitely people accessing help right now that have not accessed it before. And I am of the mind that we should make it easier for people to meet their basic needs and easier for people to survive in this society. But we're up against a system and a supermajority in the state that believes that any time you fall into poverty, it's a moral failing. And that's not the case at all. And I think for some people who are getting walloped with COVID, maybe hopefully they'll realize and change their votes. Like, you can have a health crisis, and that's also not a moral failing. Now, if you've been out like licking doorknobs at bars and you got COVID, I have some different words for you.
That would be a moral failing.
Yeah. But for for our essential workers, grocery stores, medical facilities, people who are doing jobs that we need in order for us to get, food and basic care, those folks getting COVID, it's like, they were on the front lines and, they should not be going into, medical bankruptcy because of that. And it's a shame that we are so concerned with some, bottom line versus people's lives, and that people are willing to, die for the almighty dollar, as cliche as that sounds. But it's absolutely atrocious, what it seems like a decent number of voters in South Dakota are willing to accept. Like, life could be so much better.
Yeah, and just even aside from like the what we think of initially when you think about like medical expenses for COVID, that doesn't even factor in people who end up with weird complications happening, like the long hauler stuff, or like, crazy things that are happening to pregnant women because they get COVID, and then the added healthcare costs to that. All of these things that, long term, that's going to have an impact too. It's not just this immediate acute expense, but it's going to be something where, their health expenses over time are going to be increased. Their ability to work is going to be diminished. Like all of those pieces and then again, it plays into all of these other things, like being able to pay your rent, pay your utilities. And really, like I thought about the whole poverty thing too, because when I was looking into the data, I looked up early childhood too, because we talked about that last time. And again, like, there was a resolution to just start a committee to study this thing. And I found some data that said for every dollar we spend on early childhood education, if for every dollar the state would spend on early childhood education, they would see a $7.30 economic gain return for that investment. And so likewise, with Medicaid, for every dollar the state spends, there's a $15 benefit that comes in from the federal government from that. And, if she says anything about federal not accepting federal money, I just want to be like, okay, how about that farm of yours and your husband's business, and you've got a PPP loan for that too,
Yep.
right? Like, yeah. So there's just some, thinking about like public lands that people are grazing their cattle on, like all of those things. Like we get, Army Corps of Engineers in a big river and flood protection. Like there are a whole lot of things that South Dakotans are benefiting from federal support and social programs in South Dakota, so it's really kind of, it is immoral. I like how the Democrats referring to, like, I think it was Troy Heiner referring to the budget as a moral document. Like it is immoral to basically put, like you said, the bottom line ahead of like the basic needs of people. And so the early childhood education was another one where it's like, well, we've got all this money sitting around. Why not form that commission to do this study, or give money to daycare providers who are having to shutter their doors, or more stipends to families to get help to pay for childcare. Because that's the irony. So that's what I was going with this. So, there was a study. So when Dugard, there was something I found from when Dugard was in office, and it was talking about supporting early childhood education. And they were just saying, well, we'll just give some support to low-income families. But on the same token, there's a whole lot of Republicans in the legislature who basically feel like women shouldn't be at work. We should be at home with the kids. And so that's why this shouldn't be a state-funded initiative. And so, I have a friend who recently commented, because there was like the whole backlash about the states that signed on with Texas, right, for that lawsuit. And she said they pay us just enough that they pay us so little in South Dakota that we can't afford to leave. Like you're stuck. Like you can't go anywhere. You can't do anything. And even if you wanted to, like you're stuck here kind of thing. So let me see where I found that other. Let's see. Okay. I think we got it all.
Yeah, and we're at about 40 minutes, so we should probably.
All right. Yeah, I think we got it all. Oh, I know. It was like 26% of households in South Dakota have an income low enough to be at risk for losing housing, having it, and they 63%. They have there's like a 63% cost burden in terms of what they're actually making and what they're paying for their rent. And the other thing I found really interesting is that 78% of women in South Dakota have a gender pay gap.
Yeah, I believe that.
Yeah. So anyway, any last, so the other thing we're going to do is just random rants. So before we sign off, do you have any random, so we were talking about these duplicative efforts to, try to do things. We should probably just give a plug for some of the ways that people can get involved.
So the South Dakota Democratic Party has been hosting a Tuesday night Progressive Tuesday webinar series. I believe that 7:00 is our start time every Tuesday, and it's going to run through I think most of January. So definitely check out SDDP. I want to say it's .org is the state site to find the Zoom links and the registration for that. I know county parties are kind of starting to get ready for session. So if you don't know your local county Democratic Party, you can also find that contact information on the SCDP website. Let's see, Dakotans for Health is doing, they're the first ones out of the gate with the Medicaid expansion petition. So definitely check them out and sign up for their their emails if that's a thing that you want to, find a petition to sign or circulate. And one thing that the state Democratic Party is doing as well is a lot of sort of research and surveying and talking to voters in this first quarter to third of 2021 to see what kind of base is out there, what are voters interested in. And so I know that's a question that a lot of people ask, and the state party has the infrastructure and the staff to actually answer those questions. So I really encourage people to support their efforts instead of just bitching about it in a comment section on Facebook.
Yeah. And so speaking of that, there are several groups that people can kind of tap into on Facebook. Obviously, there's a group called LEAD, which is an acronym, and it deals with, their goal is to help try to promote more progressive candidates running for office, especially women. There's a group called South Dakota Forward. There's obviously the state Democratic Party page, and then most counties have a page. There's South Dakota. There's a Voices for Peace group, which has been really, really instrumental in advocating for immigrant rights and just looking at different Islamophobia, all these other issues in the state. And so that's another great one. And actually, I'm going to put in the comments on both YouTube and Facebook, I created a Google Doc that lists different organizations, and it links to the state, the website where you can find out who your county party contacts are. And then it lists a bunch of other resources. And so, people are looking for different ways to get involved based on different issues. There's a lot of options there. Dakota Rural Action Network did I say that right? That's another one that's really great. They, you can join as a member, and then they're really active in a lot of issues related to sustainable land use issues, water rights, all of those kinds of things. And so there's a lot of different organizations out there, and hopefully that document helps stir people in the right direction. And really, again, like what happens at the local level really matters. And so we will have a session coming up in an episode in January where we talk about how to run for office. And we'll be focusing mostly on our county, but there's generally the information that's provided is kind of, I think, could be applicable anywhere. And then the legislative session starts January 12th, I believe. So we will be doing weekly ones then to talk about those different, like kind of what happened that week. But our next one, so we're going to have to put, I got one more thing about the budget that it's like been really bugging me, because I've been having conversations with another friend and peer about affordable housing and some of these other issues. So if you've ever heard of AmeriCorps or AmeriCorps Vista or Senior Corps, those are all programs that are kind of under the umbrella of the National Corporation for Community Service, which is a federal agency. Every state in the United States has a state commission for national and community service, except for South Dakota. So if we wanted to apply for a grant to have AmeriCorps volunteers in Pierre to help with microfinancing for small businesses, to help with affordable housing, to get stuff going in terms of adults reentering education, we can't apply for a grant except unless we go directly to the feds for that money. And then we're competing against all these other state commissions. So the money, we have volunteers in South Dakota, but it's like goes through, it's a very narrow funnel, like extension or some big entity applies for that money, and then they kind of have control over all these positions and how they get used, versus in another state where you have a state commission and all these other small nonprofits could apply to have a program put in their community to help support these efforts. And so, and again, you're basically paying for an administrative position to oversee the commission, because all of the commissioners are volunteers. And then you can get foundation money. You can have like this public partnership. And we're the only, I went and looked it up. We're the only state that does not have a state commission for volunteering. I don't understand that, especially when you think about how much money we would get. So that's what got me thinking about. I was like, how much federal money are we not getting because we won't do these certain things to be eligible for that money? So that's the other piece of this that just kind of like, I'm like, wait, what? And we have extra money. We could easily create a position at $40,000 a year for somebody to organize this and tell them to sign up for the Lincoln plan. Okay, so New Year's Eve, last thing, New Year's Eve will be our next Couch Caucus. And we really want to open this up to multiple people. So we'll figure this out. But we're going to play Among Us. So if you haven't figured out how to play Among Us, you should figure that out. It's a really fun game, aka Space Murder. And there's going to be some special guest appearance by COVID Christie. And, it'll just be a lot of fun. So if you want to join us to play, we can have you on the live stream here with us to play, or we will also have like a Zoom link where other people will be playing. And then what we'll probably do is figure out how to connect it to this so we can live stream that also. And people could just watch people playing a video game if you want to. Or you can be playing the game and not on the live stream at all. Like there's lots of options for how you can play the game. So just stay tuned for that. And then that'll just be kind of an opportunity for people to just kind of gab about whatever. But mostly you'll be trying to figure out how to, keep the ship alive or kill people, like depending on your role.
Yeah, or send COVID Christie out the airlock, or or into the lava, or yeah, if we start
Just
experimenting
like
with something.
eject her off the ship every time there's a vote, whether she's
Yeah.
guilty.
Just- yeah. So that'll be fun. So New Year's Eve, come play Among Us with us.
All right. Have a good night.